welcome back. And of course, as we mentioned earlier in the show, today is actually celebrated as World Tuberculosis Day. And we have joining us to be able to talk a bit about TB and what the world is trying to accomplish. We're joined by Dr. Jorge Hidalgo, internist. Good morning and welcome.
Good morning, and thank you for the invitation.
Yes. Now, I wanted to just start off by finding out, you know, when we mentioned even here at the studios about talking about TB, the stories are coming in that, did you believe that there's still people who have TB in the country? Because we don't speak about it as much, and it's not as a persistent a problem as we've known in the past, people aren't aware that we still have cases. So you're also the head of critical care at the KHMH, so you see patients who come in for this particular condition. So how often do you see it?
Well, thank you again. And well, first of all, let's say that we are globally around the world, we are facing something that we call re-emergent conditions that we used to say, okay, we have all these problems under control. Mm-hmm. Talking about not only tuberculosis, but also the tropical diseases, and one of the great examples is the Ebola, that we was thinking that probably is just for a particular region, and we are going to get in contact with that. And I'm saying that because now with the facility we are moving in those days, we are basically put on the scenario that we are living in a global village, mm-hmm. where essentially in terms of transmission of the disease, we don't have borders for that. You basically go today to Africa or vice versa. Someone from Africa come to Belize and get a condition that are very prevalent in Belize, or we go to Africa and get infected with a bacteria that is very prevalent in Africa.
You bring it over.
And then we basically bring it over, as you say. And the same thing is been happening with tuberculosis. We don't have, fortunate, a huge amount of cases, but also, again, based on what was mentioned before, we are basically in risk to bring different germs, and tuberculosis is one of those.
Let me ask you a quick question, because I've heard stories from my mom and other older Belizeans who talk about a TB ward as a part of the hospital to actually deal with it. How is it handled now in terms of when someone is diagnosed with TB? Is there still the isolation and, you know, all of that? That was a part of the reality that created a real stigma, where if someone was, you know, you were ever told that that person had TB, people, you know, tried to keep miles away from the person.
There was isolation.
Exactly. Well, you know that back to the why we are here today, one of the millennium goals of the global organization, health organization, is to try to reduce the amount of tuberculosis and to reduce the transmission of tuberculosis. Mm-hmm. In 2013, around the world was reporting 9 million of cases of tuberculosis. Most of those cases are in Asia, especially in the south part of Asia, Africa. And in our region, in Latin America region, one of the countries that have the highest amount of cases was Brazil. Now, back to your question, is that most of us, at some point, we get exposed to tuberculosis. Living in countries, in low and middle income countries, most of us been exposed to the tuberculosis at some point. And it's more or less 1/3 of the population around the world have something that we call it a latent tuberculosis. But essentially, we've been infected, but the tuberculosis itself is not active. And all of us that basically have the latent tuberculosis, we have a 10% chance in life to become ill. Mm-hmm. Of course, there are some other people that are essentially at risk. And just one of the people that are most at risk are the people living with HIV. Actually, tuberculosis after HIV is the second most important killer disease, just for a single agent.
Yeah. Yeah, it's a second riskiest infection. Is that what they call it? Yeah.
Absolutely.
So how is it treated today?
Well, back again, a little bit of the stigma of that. Basically, when someone became infected with tuberculosis and start to present it with symptoms, essentially the symptoms are basically they start with a fever, and the fever have a specific characteristic. It's most of the time presenting in the evening. You present it also with night sweating a lot in the night. And one of the most important symptoms is cough. And then when someone is coughing, then small particles in the air is those that are infected, and we inhale that, and then we became infected with tuberculosis.
Now, I wanted to talk about what is happening in the rest of the world. The main concern when it comes to tuberculosis, we've managed to get fairly good control over the condition locally. And as you mentioned, when it comes to persons living with HIV, they're the ones who are most at risk. But the concern globally is looking at drug resistance to tuberculosis and what the future impacts of that can be. Let's talk about that a bit further.
Sure. Well, as you mentioned, when someone is becoming infected, and then we confirm the diagnosis. Usually, if a common person with a tuberculosis germ that is not resistant, the treatment basically with a combination of 2 or 3 drugs can be last by 6 months to a year in a regular person. Now, what is other problem that is a global concern is the resistance of bacteria.
Yeah.
And mycobacteria, which is essentially the bacteria that cause tuberculosis, is not an exception. No? It's also a concern, because what is happening with the bacteria, they are very smart. They share genetic information all the time. They are, and then to transmit that genetic information to another, they basically learn how to resist the antibiotics.
Yeah.
And that is specifically one of the problems that we are facing with tuberculosis, that specifically with certain species of mycobacteria in the tuberculosis, that they are becoming resistant to the regular treatment.
Yeah. And this isn't only for TB, this is several other conditions or bacteria and viruses that are becoming drug resistant.
Exactly.
Now, are there different types of TB?
Yes. Well, the most common, the mycobacteria have a special characteristic that likes the areas in the body that are very, very rich on oxygen. Then initially, the most common presentation of tuberculosis, we will see that they like the upper part of the lungs, because those are more rich on oxygen. And that we have someone with a clinical picture, the classic, presented as the book says. Then we have the clinical picture, and we have the images on opacities in the upper part of the lungs. And then they form something that we call it cavitation. When someone have those cavitations in the lungs, and in the probably 15 initial days is when essentially someone is more able to infect somebody else.
Yeah.
That's why we're trying to keep those patients in isolation to prevent the transmission of air drops.
Yeah, because it is highly contagious.
Right.
Yeah.
Then, what are the different tools to make a diagnosis? They have many options. We have the skin test that we use in a way to measure. But if the skin test became positive, it doesn't necessarily mean that you have the condition. Just that you became infected in contact with tuberculosis germ at some point in your life. Then we need to do an sputum test, and we usually ask the patient to give us a sample for 3 consecutive days.
Yeah.
And then in the lab technician, they basically analyze the slide looking for mycobacteria. In other areas of the world also is available a blood test to measure antibodies, and those with the clinical picture help us to confirm the diagnosis of tuberculosis.
What has been done in terms of, because obviously the whole idea of having a World Day is to kind of heighten awareness. Is there any active kind of initiative to actually get people to still think about TB as a possibility within the confines of Belize?
Yes, actually, with the Millennium Globes goals, there are many activities that have been basically part of that, and not only today, but been for the couple of years, where essentially Belize, as part of the CARICOM, we go to Trinidad or the Caribbean region, and basically to trying to develop policies, strategies, also to trying to get in a way a protocol that us follow the same guidelines that everybody in the region are follow, and trying to do certain things in a pattern that we can create awareness, we can teach the community, we can teach the health providers as how to diagnose, as also how to treat tuberculosis. No? I mean, that is a part of the Ministry of Health around the Caribbean region and around the world. No?
Now, while we don't necessarily think of the threats of TB here locally, in the rest of the world, it still does have a severe impact on some societies. Right. You know, it's saying, the WHO reports that it killed 1.5 million people worldwide in 2013. Right. So it still is something that is of concern. What is it that you think in Belize people need to be mindful of? While it's not always an immediate threat, as you open this conversation with, anything is possible, right?
Well, I just say what is causing those areas in particular that are in most highest transmission, like the Asia and Africa, is the density. Also, there are a lot of people that basically been moved, forced to move the countries, and they are living in a situation that are very limited in general,
and may not have access to health care.
That's right, and that's made
they're very vulnerable
very
populations.
Vulnerable for that. Now, in our situation, of course, having people living with HIV, people with other situations that make your immune system weak, those are situations that can make you prone to get tuberculosis. I mean, that means that patients with diabetes, patients with chronic kidney failure, smokers, or whatever condition that basically weakens your immune system, is make you prone to get the condition. Or certain treatment, especially, you know, if probably everybody watch the commercial, with, especially with the new medication for arthritis. They always say at the beginning, if you your immune system is weak, or if you get tuberculosis at some point, you must advise, because you are not supposed to receive this medication. Why? Because if we are living with latent tuberculosis and we get those treatments, our immune system is going to be weak, and then we are having that we call it a reactivation of a latent tuberculosis.
Now, when you have a disease like this that we've seen people get comfortable because it has almost disappeared, and then there's a resurgence of it to a certain extent, how do you get financing and to actually bring attention to it again? Because people may not see it as a clear present danger anymore. There's no urgency to it.
Well, that's when I'm starting the conversation, we start to mention about the emerging and re-emerging conditions. Like an example, whooping cough or smallpox in Disneyland. I mean, we say, okay, we are not at risk, but this is not the case, no? I mean, the things are changing, and then those type of conditions that we thought a couple of years ago, we don't have tuberculosis anymore, we don't have poliomyelitis, we don't have whooping cough anymore, we have all those things under control, and now we are facing a re-emerging of those.
Yeah.
This is also creating a serious awareness around the world, what is happening, what are the strategies. I remember when I was in medical school, one of the most important goals that the centers of health want to achieve is to have a good number of people being vaccinated to prevent conditions.
Yeah. And that really is a great example. The situation of measles, and I believe the Ministry of Health had put out a warning a couple weeks ago after the Disney scare, just shows that the actions of people who live in other parts of the world also impact us.
That's right.
Thankfully, we still have a very good vaccination rate for the most part in the country. But vaccination is also one of the issues I wanted to touch on with TB and how effective they are.
Well, we have the BCG, and that we basically get as a child, and we have the mark of the TB. But we have for in this group of population, because we usually don't use it in adults, no?
Yeah.
More or less a rate of 80 to 90% of effectiveness, no? And we're still using it, no? Of course, again, with everything that is going on, most of the time we're trying to essentially go back to the routine, trying to explain to people, please, if you are coughing, cover yourself, and all those etiquettes models that we, in a situation of an outbreak, like when you have the influenza, everybody was trying to be very, very polite, and now, as every time it's cycles, no, we have a relaxation cycle, and then we forget about it, and then those things again bring us back to those things. No?
So what happens in terms of the calendar of events? Is it just an opportunity to appear in the media and get people to listen again and think about TB as an issue? Or are there planned activities related to today's celebration?
Well, there are many activities planned to create awareness. If someone want to have symptoms and want to have the opportunity to be tested, then also it's been offered. Of course, it's not like the diabetes that we can do a run test and quickly know what's happening, no? But at least to create awareness and say, okay, you know what, probably you have some symptoms, let's do an X-ray. If you are coughing and you are in a vulnerable group and high-risk group, then we need to do additional testing just to make sure you don't have the condition, or to confirm and treat it. As I told you, in a normal situation, normal scenario, when we are not dealing with a resistant mycobacteria, the treatment is 6 months, and that is curable. No? You can be cured. Can be prevented, but also we have the other scenario when, of course, if someone is becoming resistant, then it's a big trouble. In other areas of the world, they are doing phenotyping, meaning that they're trying to understand what are the genetics of the germ and trying to develop treatment based on that line.
And of course, it's also a good time to remind people that use of medication is very important to stick to whatever the doctor diagnoses, because that's what leads to the resistance in the first place.
Right.
So if you have a regimen for 6 months, complete it to the time that is prescribed.
Right. But not only that, but also when we start someone with a tuberculosis treatment, also the medications are good, but no medication is free of side effects.
Yeah.
I mean that there are certain medications that we use that we need to have a close monitoring of the patient to see if they don't develop those side effects.
And new drugs being developed?
The antibiotic situation is a concern. Not only for tuberculosis, but it's a concern for a common bacterial infection like pneumonia. And one of the biggest examples are the Staphylococcus aureus resistant. What happened, to develop an antibiotic is very expensive, and then the revenue is not very attractive. I mean that, just to compare, if you have if you want to develop a cholesterol medication that you be attached for almost for the rest of your life, versus an antibiotic that probably you're going to use only for 10 days.
Yeah.
And of course, the industry,
the pharmaceutical companies will go towards long-term medications.
Exactly.
Yeah.
I mean that the develop of new antibiotics is a concern around the world.
Yeah.
It's only probably 1 or 2 in process at this point.
So before we wrap, what would be the singular message that you'd like to leave with people with regards to TB?
Well, most important thing is tuberculosis is a condition that is preventable, and it's a condition that if you got it, is curable. If we, as everything else and every condition, if we got it in an earlier stage, the possibilities of chances of being cured is good.
Yeah.
And those, if you have a condition like diabetes, HIV, you are taking medication that depress your immune system, those are the population at risk, and you need to take extra precautions to prevent.
All right. Well, Dr. Hidalgo, we'd like to thank you very much for joining us this morning.
Thank you.
All right. We're going to go ahead and take a break, and when we come back, we'll be talking to representatives of the police department about the upcoming Black March. So stay tuned.